Welcome to UMCC Medical Consultant Connectors, where your health matters. Sudden infant death syndrome, or SIDS, is a heartbreaking tragedy. It's the sudden and unexplained death of a baby younger than 1 year old. It usually happens during sleep. We don't know exactly why SIDS occurs. It's a diagnosis of exclusion, meaning other causes are ruled out first. SIDS is a scary thought for parents. It's important to remember that SIDS is relatively rare. Knowing about SIDS and taking preventive measures can offer some peace of mind. While we can't completely eliminate the risk of SIDS, we can take steps to create a safer sleep environment for our babies. These steps, combined with regular checkups and open communication with your pediatrician, are the best ways to protect your little one. Remember, knowledge is power when it comes to SIDS. Let's work together to keep our babies safe and sound. While the exact cause of SIDS remains unknown, researchers believe it is likely due to a combination of factors. These factors may include underlying biological vulnerabilities, environmental stressors, and the critical developmental period during infancy. One theory focuses on brain abnormalities. Some babies who die from SIDS have subtle brain abnormalities. These abnormalities might affect areas that control breathing and arousal from sleep. Another theory suggests that some infants may have problems with neurotransmitters. These are chemicals in the brain that regulate sleep cycles and breathing patterns. External factors, such as sleeping on the stomach or side, can increase the risk of SIDS. Sleeping on the stomach can obstruct the airway. Soft bedding and overheating can also contribute to breathing problems. While these theories provide some insight, it's crucial to remember that having one or more risk factors does not guarantee a baby will die from SIDS. Many babies with these risk factors do not experience SIDS, and conversely, SIDS can occur in infants with no known risk factors. SIDS is often called crib death because it typically happens during sleep. There are usually no warning signs or symptoms. The baby seems healthy before being put to bed. Because SIDS has no clear symptoms, it's important to focus on prevention rather than looking for warning signs. Creating a safe sleep environment is the best way to reduce the risk of SIDS. This includes placing the baby on their back to sleep, using a firm sleep surface, and keeping loose blankets and toys out of the crib. It's important to note that while some babies who die from SIDS may have had a minor illness, like a cold, beforehand, this does not mean the illness caused SIDS. SIDS is a complex issue, and more research is needed to fully understand its causes and potential warning signs. Section 4. Diagnosing SIDS, a doctor's perspective. Diagnosing SIDS is a process of elimination. Doctors perform a thorough investigation to rule out other possible causes of death. This includes a detailed medical history, physical examination of the baby, and review of the circumstances surrounding the death. Doctors may order additional tests, such as an autopsy, to help determine the cause of death. The autopsy may reveal subtle abnormalities, but often does not provide a definitive answer. Diagnosing SIDS can be a lengthy and emotionally challenging process for families. It's important to remember that there is support available during this difficult time. Section 5. Treatment and management of SIDS. Sadly, there's no treatment for SIDS because it happens suddenly and without warning. However, there's a lot we can do to prevent it. By following safe sleep guidelines and being aware of risk factors, we can significantly reduce the chances of SIDS occurring. It's important to remember that parents who have experienced the loss of a baby to SIDS need support and understanding. The grief and guilt they may feel can be overwhelming. Sharing information about safe sleep practices and offering emotional support to families who have been affected by SIDS is crucial. While we may not be able to completely eliminate the risk, we can work together to create a safer environment for all babies. Section 6. Preventing SIDS. Practical tips for parents and caregivers. Creating a safe sleep environment for your baby is the most effective way to reduce the risk of SIDS. Follow these practical tips to help keep your little one safe. Always place your baby on their back to sleep, for naps and at night. Use a firm sleep surface, such as a crib mattress covered by a fitted sheet. Never place your baby to sleep on a soft surface like a pillow, couch, or waterbed. Keep the crib bare. Remove loose blankets, pillows, stuffed animals, and crib bumpers. These items can obstruct your baby's airway. It's safest for your baby to sleep in their own crib or bassinet in the same room as you for at least the first 6 months, ideally for the first year. Dress your baby in light sleep clothing and keep the room at a comfortable temperature. Don't overbundle your baby. Offering a pacifier at nap time and bedtime can help reduce the risk of SIDS. Breastfeeding is linked to a lower risk of SIDS. Breastfeed your baby if you can. Provide supervised tummy time when your baby is awake and alert. This helps strengthen their neck and back muscles. Keep your baby's environment smoke-free. Exposure to secondhand smoke increases the risk of SIDS. Take your baby to all scheduled well child visits. Your pediatrician will monitor their growth and development and can address any concerns you may have. By following these evidence-based recommendations, you can create a safe and nurturing sleep environment for your baby and significantly reduce the risk of SIDS. Remember, knowledge is power, and taking these preventive measures can offer peace of mind during this precious time. UMCC, your ultimate medical consultant connector.